Welcome to video number 1. In this video I'm going to talk about the 3 common mistakes that are made when managing polycystic ovaries. Managing polycystic ovary syndrome is often quite poorly done. Polycystic ovaries is a condition that little is kind of known about the causative mechanisms, and most medical advice actually ignores the latest research, and it tends to keep recommending the same 3 suggestions that I think is actually some of the worst advice that you can get when it comes to treating and managing polycystic ovaries well. Polycystic ovaries is fundamentally an issue with insulin regulation and how your body uses insulin and glucose in the body. When that system is broken, our hormones get all out of whack and we get this ever-increasing spiral of disease that starts. Polycystic ovaries is a hormonal condition which affects many parts of a woman's body. With polycystic ovaries, your reproductive hormones in particular are out of balance, and this of course can then lead to problems with your whole reproductive system. You don't get your period so often, many don't ovulate, or very often sort of only ovulate every now and again. This then affects your estrogen and progesterone balance, and the higher your estrogen levels, the more tendency you're going to have towards putting on weight. Women with polycystic ovaries also have high androgen levels. They're sort of also known as the male hormones, or sometimes just referred to as testosterone. Women actually do need these hormones as well, but women with polycystic ovaries do tend to have quite a bit higher levels of androgens, or sometimes your doctor will just call it testosterone. Testosterone is just one of multiple types of androgen. A high level of these male hormones in a woman can cause things like male pattern baldness, hair in places that you don't really want it to be growing, and trouble getting or staying pregnant. Also tied in with polycystic ovaries is this thing called insulin resistance, and for whatever reason that triggers this all in the first place, what happens is your insulin levels are raised, and this causes your cells to become less sensitive to insulin. Insulin's kind of like that annoying guy that keeps throwing things through your window. So your cells just get well and truly sick of all the sugar flying in through the window, and it's getting fuller and fuller. It just can't hold any more sugar in there. So your cells actually sort of start boarding up those windows to keep all that insulin out. And this means that your body has to make more and more insulin to get that sugar out of your bloodstream and into your cells, because sugar in your bloodstream is really dangerous. If it's high for any period of time, you can end up unconscious or dead. So obviously your insulin has a really important role to play, but there's only so much room in your cells for this glucose, so your body has protective mechanisms put in place to try and stop it coming through. This raised level of insulin then triggers a release of extra estrogen, extra testosterone from the ovaries, and on top of that, extra insulin that's running around through your body can also act as testosterone on certain cells that can bind to some of those receptors. Raising your estrogen levels also encourages fat storage. Estrogen is one of your fat storage hormones as a woman, and the problem with that is fat cells also produce estrogen, which then of course encourages more fat storage, and you can see how this becomes a big deal. Insulin's main job is to shunt that sugar from your bloodstream into your cells. But because there's been so much insulin around for so long, those cells have just boarded up so many of those windows to keep out that insulin and that sugar. So despite your cells screaming, "I'm hungry, give me sugar," they've actually blocked up most of the portals that will let the sugar come through. So you'll be craving carbs, craving sugar, but your body will just continue to get bigger. So you'll feel hungry a lot and crave those things, but your body's not actually using them well. Meanwhile, your poor liver is struggling with all this extra sugar that you're eating and all these carbs, and it has, it's got to turn those into fat. And so as well as that, sometimes the fastest option is it turns it into fat and just tucks it away in the liver. This is particularly the case if you're eating fructose. So 50% of your table sugar is made up of a type of sugar called fructose. It's also found in fruit and other plants. And this fructose, your body will just convert straight to fat and chuck it into your liver. And this is the result of this is we've got a large increase of people that have got non-alcoholic fatty liver disease. Fatty liver disease used to only ever be seen in alcoholics, but these days with the amount of fructose we've got in our lives, we're getting people that are actually needing liver transplants because of the amount of sugar we're eating. So onwards and upwards, the 3 common mistakes made in managing polycystic ovaries. The first biggest one that your doctor will probably recommend the moment that you're diagnosed is to go on the combined oral contraceptive pill. Now this, in theory, the design of that was to try and just halt everything and to give your ovaries a rest. What actually happens though is your body is already producing too much estrogen and not enough progesterone, and you've just turned off the ovulation or any chance you have of ovulating to produce that progesterone. So the average population, when you put them on the pill, they put on weight. So you can only imagine what will happen with someone who's already got a lot of estrogen running around. You put them on the pill, they tend to put on more weight, and it sort of just blocks that whole feedback system that we're trying to encourage to develop and to develop correctly. In women with polycystic ovaries, the pill can take, well, in a normal person it can take 6 to 12 months to wear off. In a woman with polycystic ovaries, I've heard of people taking up to 5 years before their body can re-regulate and get that cycle happening again. So I really don't think that going on the pill is actually that beneficial at all for women with polycystic ovaries, unless you're about to undergo sort of a procedure or whatever for fertility, and they want to calm down all those cysts. In which case it's fine to use in a short period for that, because it'll give everything a rest and your cysts will go away. But just because you don't have cysts doesn't mean that your body's fixed, and just because you're having your period thanks to a pill doesn't mean that your body is fixed. The moment you stop all that, your hormones are still broken, and you will still struggle with ovulating, and you'll still struggle with that hormone imbalance. The next big mistake is thinking that weight loss is the only solution. If you've been told by a doctor that you have polycystic ovaries, generally speaking, they will tell you to get it under control, you need to lose some weight, especially if you're trying to get pregnant. I can guarantee you they will tell you you need to lose weight and it will be better. And again, this isn't totally wrong. And to be fair, all 4 of my pregnancies have been conceived after losing some weight. But it isn't actually that weight loss that causes the ovulation and the subsequent pregnancies. It's actually the low carbohydrate diet that I employed to get that weight loss that eventually helped. Of course, your fat stores estrogen, and estrogen is that hormone that encourages your body to store fat. So the bigger you are, the harder it is going to be to lose weight. In a woman who ovulates regularly, she releases that progesterone in that second half of her cycle. So her cycle is split clean in half. One half is estrogen dominant, the other half is progesterone dominant. And that progesterone, it raises your basal metabolism, speeds it up so you get hungry, and it encourages you to burn that fat. So a woman who ovulates regularly, she gets that half and half. With women with polycystic ovaries who don't usually ovulate regularly, this means you're actually missing this progesterone counterbalance, making you very estrogen dominant. And one of the big symptoms of estrogen dominance, other than a regular cycle, is that apple-shaped body, where you're sort of big around the middle. So polycystic ovaries is of course made worse by higher estrogen levels. And so the higher your estrogen levels are, the more weight you will gain, which will push your estrogen levels higher, and it makes it harder to ovulate, so your estrogen levels will go higher again, and it really is a horrible, horrible upward spiral. And so the message, lose some weight, really doesn't help.
It's also worth noting that weight isn't actually the issue at the end of the day. The issue is a hormone imbalance, and that's why there are, in fact, skinny sisters. There are skinny women that have polycystic ovaries. You can be insulin resistant and not be fat. You can have developed type 2 diabetes with severe insulin resistance and not be fat. People do respond to it differently. But everybody that has polycystic ovaries has some degree of insulin resistance. It is the foundational core issue with polycystic ovaries. And so the third biggest mistake in managing polycystic ovaries is recommending that you follow the classic low-fat, high-carbohydrate diet. Of course, when you're told to lose weight by your doctor, the classic advice is to go low fat, which in turn pretty much always means that you're going to end up doing high carb. This means three things. One, you're going to be hungry all the time, and this is horrible. And that feeling of being hungry all the time stimulates your body to lower its basal metabolism to stop you losing weight. In fact, if you eat low fat and you're hungry a lot, and with those low calories, your body will simply reduce your basal metabolism to meet with what you're eating, and sometimes even lower, and so you'll be eating hardly anything and still gaining that weight back. You'll have to eat constantly to feel satisfied, and people say, oh, eat 6 to 8 meals a day because that keeps that metabolism running, but actually that's not really the case. And the science behind that is not there. It's just not there. We've been told to snack by the industry that sells us dieting pills and that sells us snack food. So the snacking 6 to 8 times a day, the only reason you want to do that is because you're hungry all the time, because you're not getting satisfied by eating enough fat. High insulin levels that are caused by this eating carbohydrates again and again will just continue to make your polycystic ovaries worse, which of course is the opposite of what we're trying to do. Fat is not bad, okay? Fat is not bad. We're so programmed to avoid fat in our meals, but fat does not actually make you fat. Fat trains your body to burn fat as a fuel. So eating this high-fat, low-carbohydrate diet actually does wonderful things for polycystic ovaries. You manage to keep your insulin levels low and steady for long periods of time, and your insulin is the gatekeeper to those fat stores. If your insulin levels are high, no matter how hungry you are, you will not be able to access those fat stores to burn them. If you can get those insulin levels lower, your body has free access to get those fat stores that you've got there. Your body will grow new mitochondria. Mitochondria is the fancy wee term for the little factories that turn fat and energy into energy. And so when you become a fat burning machine, you have a lot more of this mitochondria. Your brain will feel a lot more focused and sharp now that it's free of all those carbohydrates, and it's primed and it's running on ketones. And the best thing about eating a high-fat diet is your hunger goes away. Your body is finally satisfied. After a small adaptation period of a week to 2 weeks, you will suddenly realize that you're just not hungry anymore. I mean, obviously you need to keep eating, but that hunger goes away. That never being able to be full feeling, it goes away. And the best thing about that is that your body can access those fat stores and you'll just start losing weight. It's that easy.